The role of a geriatrician in the community is very important because there are not enough geriatricians to serve the growing population of the older individual in the United States and in the world. It's important for geriatricians to be good communicators, especially good teachers, of what it is to be taking care of older persons. A geriatrician needs to be able to work with a good interdisciplinary team, be able to share ground with multiple specialists, and have a lot of well-rounded conversations on how to best care for the older population. It is also important for geriatricians to be leaders in the thoughts of constructing the new health system, building new models of care in the inpatient and the outpatient setting in order to better achieve the highest quality of care for our aging population. There are really not enough geriatricians and persons trained in the care of older persons to meet the needs of the growing population of older persons. So we definitely need more geriatricians, geriatric nurses, social workers, psychiatrists, everything in the realm of geriatrics we do need more of. As a geriatrician and looking at the needs of our older population, I feel that our country hasn't caught up to the needs as they stand. We need structures of models of care of inpatient and outpatient clinics that can take into account the growing complexity of these older persons who are living longer with more comorbid conditions. They are increasingly wanting to live more in the community, and they want to maintain their independence. Their access to transportation is something that is really difficult, especially in New York City. Their access or their ability to receive care, caregivers is another realm where we are struggling to find support. If a person doesn't have family or relatives or friends, the home health aid, the caregiver community is also something that needs to be addressed. Access to nutrition, meals, access to help with finances and how to handle other matters that a person as they get older may have more difficulty with managing. All of these kinds of supports, social determinants of health, in addition to the medical needs, are things that we really have to catch up to in order to serve our older generation in the highest quality way. One way that the American Geriatric Society and geriatricians are trying to promote the knowledge of what it is to be a geriatrician is by creating a mnemonic of the 5 M's of geriatrics. And so these 5 M's are mind, mobility, multi-complexity or multimorbidity, medications, and what matters most to the patient. And so using these 5 M's is a way for the geriatricians to illustrate how they might go through the discussion of an older individual and meet all of the basic kind of thinking needs in managing their medical and social care.